Welcome back to the Caribou Data Science channel. Today is October the 16th, 2020. I'm going to run my COVID-19 in 6 minutes report for the country, for the U.S. So let's just go ahead and run that report right now. By the way, before we get started here, I would appreciate if you click the red button in the bottom right-hand corner screen and subscribe to the Caribou Data Science channel. I'm currently at 40, and I really want to get up to 50 by the end of next week. So anyway. The other point is, if you have any suggestions, requests, be sure to just put them in the comments below. I also include links to both the code, the data, and the web page for this report. So the U.S. is currently averaging 29,555 per day, cases per day, 938 cases per day. That's actually down by about maybe 10, 949. I guess that's why Washington University's team lowered their model for deaths. Of course, here's the thing. Here's my complaint with Washington University. You know, if you change the date enough times, your number will be correct. So if I say 500,000 deaths by December, then it gets up to November 30th. I say, well, then I change that date to January, and it doesn't. It's obviously it isn't going to make that number by January. I'll change it to February. Well, sooner or later, we will have 500,000. Just as an example, sooner or later, we will have 500,000 deaths, COVID-19 deaths. It's just a question of when. Well, if I can keep changing my date, to me, that's not really much use. Okay, because we're not really measuring the actual impact of COVID-19. It has to always be tied to a date, and the date has to be fixed. Okay? At least that's my opinion. But anyway, first let's take a look at the U.S. mortality rate. This is 5%, so this is maybe 3.5. You can see that from here onwards, the mortality rate, the day mortality rate is either less to or equal to the average, which is, again, it's about 3.5%. Look at cases, you can see cases are continuing to increase. They begin back here. I hate to say it, but it's really nice. This would probably fit a linear regression model really well. I mean, because this is straight up here. Now the blue line is interesting. Blue line, the shaded line, is the current estimated mortality rate. And this comes from, again, from Washington University's Institute for Health Metrics and Evaluation. They're saying a 7 to 21 day incubation period. So it's the time from when between the first symptoms occur until deaths occur. Now this chart is moving this way, right to left. Okay? So we should be seeing the deaths for the cases within this green line right now. Gray line right now. These are days to come. These dates are already passed. So this means that the deaths for this period here has already occurred. This is the current period where deaths are occurring. Okay? Dates yet to come. Take a look at deaths. As you can see, deaths are continuing to decline. Although maybe leveling out here just a tweak. But you can see still well below this here and still below this number right there. Let's zoom in and take a look at the cases from June onward. Once again, the 17 to 21 day incubation period. Cases. You can see there was a slight trend up here in deaths. Okay? But still well below these numbers here. Weekly cases, this is the average number of cases per week. As you can see, we've had a lot of weeks with the cases above the average. Now this is deaths. You see the exact opposite. Look at all these. This is the average number of deaths per week, which is currently 938. No, that's not right. The current deaths per week is about, this is 7,500. So this is about 7,000 deaths per week right now. But look at all the weeks, including starting here, where the deaths are below the average. A what? Uh, so you can see here even when we're spiked here, deaths are continuing to decline. Okay? The spike was here. Now we're continuing this downward pattern and a second downward pattern from here on down. And this will probably finish with this number right here. As you can see, deaths are declining in the U.S. Despite, I know, I haven't seen any cats either. Despite this massive spike in cases here, deaths are falling. And you can see the same thing in the monthly. But look at this spike in July, August, September was a decline in cases. July, August had a bit spike, but then followed by a decline in September in cases or in deaths. 1431 to moving average. Again, I'm not sure. It's interesting, but not necessarily useful. So anyway, thanks so much for your time today. I hope this report has been encouraging to you, as it has been to me. The decline in the deaths means that the sacrifices you and me are making in America is working. So keep up the fight. Wear the mask, practice social distancing, avoid unnecessary groups contact when you can. We will beat this disease yet. God will redeem his people yet. Okay. Thanks so much for your time today. We'll catch you on the next report.